Out the Leader of his party.
Thank you, Mr. Speaker. And I want to start out by thanking the member from Moncton Centre for moving this motion in the first place. It's long overdue to have this debate really in this House of Assembly. So I'm grateful that he chose to bring this forward and that he got the support of his caucus colleagues to bring it to the floor for debate today. And I'm also thankful to hear that the Minister of Health supports this motion to accelerate the mental health action plan that she's released to ensure that the funding is in place to do that and to finally put in place the mental health advocate without further delay. When I was first elected, Mr. Speaker, in 2014, I assembled a youth roundtable as kind of a youth advisory group, and it still exists today. And I invited representatives from the student councils and student unions of the high schools in Fredericton, the two high schools in Fredericton South, the middle schools, the universities, both universities, the community college and the craft college, Mr. Speaker. And at one of our very first meetings, I said, okay, what's really important here is to find out what you think should be the priority in terms of issues that are important to you as youth for me to raise in the Legislative Assembly. This was the fall of 2014. And to a person, they said mental health and mental health services. And, you know, I was brand new as an MLA, and I was struck by the unanimity and the insistence and determination of the young people who are on the roundtable from all the educational institutions in the riding here, that that's what needed to be focused on, Mr. Speaker. So obviously it's an issue. As a new MLA, I had no idea. And as I dug into it with them, talking to and hearing from people working in the trenches, people with expertise on the policy side, on the clinical side. We had some workshops. It certainly became clear to me why they felt this was such a priority, and also hearing people's stories, of course. So I began speaking about it in the Legislative Assembly and advocating for ideas to improve the system. The courage of Lexi Dakin's parents and family to speak publicly about Lexi's mental illness and suicide has created this moment in time, thanks to their courage, where real change can happen. And so this is that moment, Mr. Speaker. Lexi's parents, and particularly her sister Piper, were instrumental in putting together a petition calling for an inquiry into Lexi's death and the events that surrounded it. And Piper played an instrumental role in that, and I tabled that, presented that petition in the Legislative Assembly. But at the same time, an online petition was set up, Mr. Speaker, and over 640 people signed online requesting a public inquiry into the death of Lexi Dakin. And as online petitions permit, there's comments, and every one of those, just about 640 people, made comments. Things like, I just went through the same thing. My brother committed suicide in January 2021, and the healthcare system failed him. My daughter sat for hours with her husband in the ER just to be told he's good now, he could go home, many exclamation marks. I'm signing as I have also lost a loved one to suicide and have been failed by the system. This needs change, to have changed yesterday. My daughter has had similar responses trying to get help. This needs to change. Lexi's legacy hopefully will be changed to our mental health care system. As someone living with mental health with mental illness, I am in strong support of changes in regards to the available help in this province for people like me taking that first step in seeking immediate help. Please understand that this is not something that should be taken lightly, and in a lot of cases, it's a matter of life or death. Mr. Speaker, those comments run through this like the ones I just read over and over and over again from many people with direct experience. So one of the things I'm hoping, Mr. Speaker, is that the Child and Youth Advocates' work on this has been split into two. So Child and Youth Advocate is working on their investigation into mental health emergency services. And they also parse the work off so that another member of their team is specifically looking at the situation and the events surrounding Lexi's suicide. And so, Mr. Speaker, I'm hoping that, and I've made this suggestion, that the Child and Youth Advocate will divide the results of that work and bring forward the piece dealing with Lexi's, the circumstances surrounding Lexi's suicide, and present it to this legislature through PP Locke, Committee on PP Locke. And so the Child and Youth Advocate will be appearing before PP Locke in June. And why I mention that, Mr. Speaker, is because there's an opportunity for him to present while people are still paying attention. I expect that piece of the work will be done by then. He said that the full report won't be done till July. So he will be appearing before the committee, and I'm hoping and asking that he present the results of the piece of work around Lexi's suicide, because parents do need to know across this province what happened, and therefore can get a better sense of what needs to be changed to make a difference in the emergency mental health care system, Mr. Speaker. So we shall see, but to me that seems like a real possibility, and I think that may, if that comes about, respond positively to the call for the kinds of results that an inquiry might have generated. So, Mr. Speaker, there are an incredible number of people in the healthcare system who don't know much about mental illness. And in my early sort of inquiries into this as an MLA, it was surprising to discover that most physicians have had little training in mental illness and mental health. And I recall having a physician with a family practice who also had significant obligations to the hospital saying, I don't know what to do really, where to refer young patients who are struggling with their mental health. I don't know, I wasn't trained for this. And that's the same for lots of people in the healthcare system, Mr. Speaker. Their training isn't there. Their focus and what they learned is much more on the physical health side, and that's part of the problem here, I think. The gateway everyone assumes to mental health care is through the ER, through the hospital, but as we're seeing, that's really not the case.